Today I'm going to discuss about one of the blood tests. One of the basic blood tests in the medicine is called as full blood count. So full blood count in number of the countries is actually, some countries is called as a full blood count, some countries is called as a complete blood picture. So let me tell you some basic points. Why we do the full blood count test, what is the interpretation. So I'm going to say about a few important parameters what we check in the full blood count. So number one is called as red blood cells or BCs. The red blood cells is obviously defined as a number of we do have a blood cells which carry the oxygen in our body part to make the oxygen available to the tissues, cells, and all the organs in our body. Another important constituent is called as hemoglobin. Pigment, hemoglobin is basically a pigment which are carried by inside the red blood cells. There are a different value, although today's this video is not about the values, basically different constituents and why we do the full blood count, because the values are different in the labs, slightly different in the countries. I will explain about the different range and the values in the end. Another important constituent is called as the white blood cells. Now the white blood cells have a different interpretation. They can increase or decrease in number of the infections. And finally, there is a last component, the major component is called as platelets. Now the platelets are the constituent which help to clot of, means helping in the clotting of the bloods. So full blood count is one of the basic tests when anyone who present in the hospital to the local GP services, we do this test. Now there are a few categories. We diagnose a lot of the diseases on just basis of this one single test. You should be good to interpret and correlate with the patient clinical symptoms, physical examination, and then when you order this full blood count to justify your previous history and diagnosis. Now there are a number of the conditions which we diagnose on this. So number one is called as anemias. Now anemias are different in the different groups, but on the full blood count we simply diagnosed iron deficiency anemia. How we diagnosed? Same, red blood cell count may be low, hemoglobin is low, and we always, when you as a junior doctors or those medical students, just for them, when you correlate the hemoglobin, always see the MCV, which is again an important constituent, mean corpuscular volume, MCV. So if the hemoglobin is low and the MCV is low, then surely on the basis of history, physical examination, then you easily diagnose this is iron deficiency anemia. You can again, second category is called as thalassemia. Another anemia, which is anemia of chronic disease, you can also have some understanding when we do the full blood count. Again, one of the very important anemia, which we called as megaloblastic anemia, where the hemoglobin is low and the MCV is quite raised as per the reference range, then we easily diagnosed on just full blood picture. Obviously, why I say again and again about the history, physical examination in the blood test. This logical sequence will help you to explore easily number of the diseases. So these are the anemias. Then we certainly diagnosed infections. Any viral infection, bacterial infection, commonly we have a lot of viral infections. So what happened in the viral infection? The WBC count predominantly goes low. So there are the ranges, less than 4 and above 11. These two counts are abnormal. So less than 4, number of the viral conditions, any acute viral illness. Now there are the different number of dozens of the viruses commonly, but as I say, Epstein-Barr virus, cytomegalovirus, certainly in different geographies, different viral diseases. Even we don't test certain viral common cold Certainly other connective tissue diseases like lupus disease, the WBC goes low, and some other autoimmune conditions when the leukocyte count decreased. Certainly some infections, some chemotherapy drugs like the cancer medication, when they suggest or give the patient, the WBC count goes low. Now, when you come to the point when the WBC count goes above 11, then there are certain bacterial infections. Now, this is just umbrella bacterial, any bacterial infections, pneumonias, urinary tract infections, tummy infections, brain infections, then the leukocyte count again go high. So again, history, physical examination, and the WBCs will help you to narrow down your differential diagnosis. Again, certain cancers we call as leukemias. If you are a very good physician, history, examination, and then even just a full blood count, CBC, complete blood picture, help you to narrow down the differentials of acute leukemias. So when there is a red blood cell count is low, hemoglobin is low, there is a WBC is either very low or very high, and the platelet count. Sometimes we have a peripheral smear, which also very important. Now there is a different manifestation, we say bicytopenia or pancytopenia. What is the called as a pancytopenia? I hope I can make another video what is and what are the manifestation and what are the diseases. But just simply to tell you, when there is a 3 cell lines, red blood cells line, hemoglobin, WBCs or platelets, any 3 lines, when they decrease, we call it as a pancytopenia. So with the leukemias, if such a condition happen, you can easily narrow down differentials of leukemias. Now there are chronic inflammatory conditions you can easily diagnose on the full blood count. Like certainly the chronic inflammatory conditions, the platelets goes high, you will find anemia of chronic disease. Then there is one of the most common platelet disorder worldwide and predominantly in the women. When you have all the cell lines normal and just the platelets goes low, then you easily make a differential diagnosis, history, physical examination, idiopathic thrombocytopenic purpura, platelets are low. Again, various other diseases, chronic liver disease, when you have a low platelets and hemoglobin can be low or normal. Certainly some tropical countries, for example in the Asia or Africa, when people present with acute high-grade fever, malaria is easily picked on the full blood count, low platelets and peripheral smear, dengue viral hemorrhagic fevers. So I'm just concluding, this is very sufficient today, that full blood count, complete blood picture. If you have a good thorough history, physical examination, then interpreting the full blood count is very, very important. A number of the conditions can be very narrowed down and you can only diagnose and treat on the basis of this one single test. If you like this video, kindly share and subscribe my